and to eradicate systemic micrometastasis. I'm going to touch upon these two landmark trials published on the same issue of NEGM. One was in USA, one was in Europe. First, talk about the EORTC, the European group. It was a multi-country, multi-center trial, and they have recruited all the squamous cell carcinoma in adjuvant setup, covering most of the common site, and taking the high-end disease like T3, T4, or early stage with higher nodal group, or with many risk factors, without any distant metastasis. And the schema was very simple. After surgery, they have randomized one group to give post-operative radiotherapy, 66 day, 33 fraction. Other was with the same radiotherapy of 66 day, they have given weekly cisplatin, 3 weekly cisplatin of 100 milligram per meter square. Primary endpoint was progression-free survival, and secondary endpoint was overall survival, local control, and complication. Both the group was well matched in demographic and also in tumor statistics. If you look at the outcome after 60 months follow-up, the primary endpoint was achieved with a statistically significant difference between chemoradiotherapy versus radiotherapy. And the secondary endpoint of overall survival was also achieved. And locoregional relapse was much less in the combined group compared to radiotherapy group. Interestingly, the late adverse effect was not significantly different between both the groups. Now, what about the American group, the RTOG one? It was also a multi-center trial, and they have recruited almost similar group of patients, but their radiation dose was 63, not 66 for all patients. And their primary endpoint was locoregional control, which was achieved with a statistically significant difference, and disease-free survival was also achieved. But their overall survival was not statistically significant. To fail to achieve the OS, people may think the lower dose could be the factor there. But if you look at the toxicity, as expected, the concurrent chemoradiotherapy had higher toxicity compared to radiotherapy arm. So a meta-analysis was done combining these two studies, and it was published, and it was shown in the inclusion criteria of high-risk group